thank you for tuning in to this edition of Tees Valley Sport Podcast. This week, I'm joined by James and Lauren from You've Got This. You've Got This are one of only 12 local delivery pilots in the country. We'll hear a little bit more about what they do in their jobs, a bit more about what You've Got This does and what support they offer to people in the South Tees, and we hear a little bit about their backgrounds and how they got into working for You've Got This. If you are enjoying these episodes, please do subscribe to our YouTube channel or subscribe via Spotify or wherever you listen to audio podcasts. Thanks for listening. Okay. Morning, James. Morning, Lauren. How are you both doing?
Morning. You all right?
Brilliant. So, Lauren, do you want to first off just introduce yourself, your role, and your background in sport and physical activity, please?
Yeah, of course. So I'm Lauren.perkin. I'm a programme officer with You've Got This. And my background in sport and physical activity is I've always kind of been a little bit sporty, but I was never really kind of very good at any sport. I've always just been bog average at pretty much all of the sports. So I would always try my hand to pretty much anything. But my main kind of sport is hockey. And through kind of lockdown, I've realised why I've kind of stuck with hockey. And it isn't about actually keeping fit. That isn't the thing that kind of keeps me going, but actually it's around my group of friends that I've got that I've played hockey with now for around 10 years. So that's me.
Brilliant. James, how about yourself?
Hi everyone, James.Hartley. I'm one of the other programme officers for the You've Got This pilot. I suppose my background in sport has always been playing football. Played football from a very early age all the way up until my mid-20s. And then I realised that people were getting faster than me, so I kind of gave up before I got left behind. And I suppose now leaving football behind, I try and do a bit of running. And I suppose like all footballers, when they don't play football anymore, they try and play golf as well. So when I've got time to actually get on the golf course, I whack myself around the best I can. But yeah, just a bit like Lauren, really. Sport's always been a part of my life, I suppose, and it's kind of molded the way that I've gone with a career and what I did through school and education and stuff. And obviously the huge amount of wider benefits to being physically active and getting involved in sport are massive, and it's something that I really enjoy.
Awesome. So, Lauren, I'm going to come on to you straight off for the first question. For those that don't know, what is You've Got This?
Yeah, so the name doesn't really give it away, does it? So You've Got This is actually one of the Sport England local delivery pilots. So there's 12 of us across the country, and we're focusing around inactivity. So that's people who do less than 30 minutes of physical activity a day. And some of the core principles of You've Got This is around a whole systems approach to tackling inactivity. So that's around not just focusing on the individuals and organisations in the place, but trying to change policies and the physical environment. So working on around actually changing policy within councils, local authorities, within small organisations as well, so to support their workforce to be more active as well. And then additionally, stuff around the physical environment is actually around trying to make people want to feel safe, to be able to go out into the green spaces and parks or walk the streets or go on the bike to work. So our programme's quite broad and we're always quite kind of incorporating behaviour change into everything we do so that it's a sustainable model. So it's not just around doing activity for the sake of it, but it actually becomes part of what you do. And that's why our vision is Active Lives as a Way of Life, which was co-created with all of our ambassadors, who are all the different organisations across the South Tees. So we cover the South Tees.
Based, yeah.
Yeah, so we cover the South Tees. However, we do some place-based working within 4 focus wards, which are North Ormsby, Brambles and Thorntree, South Bank and Grangetown. However, there's also some other work that stretches across the whole of the South Tees.
Awesome. So, James, I'm going to come on to you. How did you start working for You've Got This, and what's your career path? So what's led you to You've Got This?
I suppose what led me to work for You've Got This was that I was probably in quite a lucky position in that my previous role was working at Middlesbrough College. I was at Middlesbrough College for three and a half years around trying to support students to become more active. Sport England data told us that students, once they hit around 16, 17, the activity levels really start to drop off. So Sport England, along with other governing bodies, provided funding for colleges to try and increase physical activity levels and opportunity for people of that age. So when the local delivery pilot was being discussed and, you know, a bid was being put in place to bring it to the South Tees, I kind of got part in the consultation phase of all that. I kind of got to know what the bid was going to look like, what it was going to try and do. I kind of inputted my experience and thoughts from a college point of view. So I suppose when the jobs came out and the funding was agreed and the South Tees got an LDP, I saw it as a really good opportunity to be a part of it. So obviously put myself forward and managed to get one of the officer roles. So I kind of knew a little bit of the background information and some insider knowledge, which helped with the application. But I suppose going back to my career, I graduated in a degree in sports studies, and then started to work for universities around supporting student clubs and student sport, you know, making sure that students had opportunities to be active, whether that's competitively or just through fun, whilst doing their studies. So I worked at a university in York. I went up to Newcastle and worked at a university there. And then left there and went to work for an active partnership up in Tyne and Wear. So very much similar to what Tees Valley Sport does, but in Newcastle, Sunderland, Gateshead, that area. And then came back down to Middlesbrough and worked for Middlesbrough College. So I suppose my background is very much sport development, and probably very much working with people that already do want to be involved in sport. So from a university point of view, a lot of students who had an interest in sport but just wanted to do more of it. So I suppose an easier side of sport development, really, because people have already got the motivation to do something. Whereas when I went to Middlesbrough College, it was very much working with the inactive students that aren't interested, don't see the benefit of it, really aren't that engaged and interested, really. And obviously then that's led me to work for the You've Got This pilot, which again is working with communities that might not see an interest or don't see it as something that they've got the capacity to do. So I suppose we're really working with the right people, because, you know, if we can really change their behaviours and give them a healthier outlook on life, then physical activity can have a massive role in doing that, really. So yeah, that's me.
Awesome. So Lauren, I know from knowing you previously that your background is completely different to that. So let's hear your background and how you got to work for You've Got This.
Yeah, so I am not a sport or physical activity officer, and I've never done any sport development at all within my previous career. So I actually started off with the idea of being an English teacher, which was a great idea, until I actually went into a school and I realised it really wasn't for me. And I really kind of didn't enjoy it. So I kind of jumped and kind of floated around a little bit and jumped into the private sector, the big bad world of the private sector, and was within an organisation that does stuff around workplace health. So it was around, you know, DSE assessments, ergonomics, that type of stuff. And then I was kind of a bit like, this isn't really my, you know, where I want to be. I want to be, you know, working with communities. I like chatting to people. Like I'd previously done work in Middlesbrough on like a voluntary basis around working with ethnic minorities around why they don't access public health services. So, and I'd also done my RSPH around health champion stuff. So I kind of took a bit of a leap and got a job at Middlesbrough Environment City, which is a local sustainability and environmental charity within Middlesbrough. And I was working on a programme called Sugar Smart originally, which was actually a Jamie Oliver programme around nutrition and trying to get organisations to reduce the amount of sugar that they were putting, like that was readily available. So working with, you know, colleges and schools to increase the awareness within young people, but then also working with, like, you know, like I worked with Middlesbrough Football Club around how they could support their families and young players and to understand how to actually eat well. So I worked with the healthy cooking team as well, And then from that, I continued to work at MEC, but then actually stepped into a role around called Food Power, which is around food poverty. So we created the Food Power Alliance, which was a large partnership covering Middlesbrough, who are all people who would be working with people who could potentially be in food poverty or food insecurity. So food insecurity is kind of you're all right month to month, but if your boiler breaks, you're in poverty. So that's the kind of thing. So how can we support all of those? Which actually kind of lends itself quite well, because quite a lot of the role that we're doing here, these are the things we need to be aware of, that actually, you know, saying, do you want to pay £5 to go to the gym, just sometimes isn't feasible for people. So we need to understand how we can actually support people to both prioritise, but also actually create the opportunities that are fair and able for people to be active, and also make them aware that it doesn't have to cost money. You know, you can take your kids to the park, that's still being active, and that's great. And then from there, I obviously Middlesbrough Environment City are also one of the ambassador organisations on our exchange. So I kind of spotted kind of that going around and people talking about it and talking about this bid, and I was like, what's this going on? And I thought, I was actually on holiday at the time when the jobs came out, so I rushed back from Mexico to quickly write the application, and then I kind of there was 2 posts, so I went for both. I thought, hedge my bets. So my role was going to be programme support officer, but due to the large scale of the programme, they've increased that up to a programme officer. So that's where I am now.
Awesome. It's amazing, isn't it, how 2 people of such different backgrounds have come together to work for the same organisation. And I mean, I know you both well from outside of this, and the way you guys work together is amazing. And it's just brilliant to see how much you've come from 2 totally different backgrounds to work so closely and so well together. So it's amazing. It really is. So moving on, James, what are your main projects that you work on for You've Got This? So what are kind of your main focuses?
Yeah, so like we said with the pilot overview that was given by Lauren, the project's almost split in half, really. You know, me and Lauren do the same job. We've got the same job title, but I say we do the same job. Our work focuses are very different. So we've got our 4 focus wards, 2 in Middlesbrough, 2 in Redcar. I try and support the wards in Middlesbrough, so North Ormsby and Brambles and Thorntree. So any work that we do with communities, local people within those wards, that's kind of my responsibility and my job to support those people. And then we've got quite a health and medical element to the pilot, which we've not spoke about yet, but that's kind of focusing on 4 very different themes around health and well-being. So I'll briefly talk about all 4 and then tell you which 2 I kind of support. So we're trying to work with healthcare professionals around getting them more comfortable to talk about physical activity and to promote that through their patients. We're working with Slimming World, who are the weight loss provider that encourage people to lose weight. So we're trying to work with them to again promote the importance and the need to be physically active. We're working with the South Tees Trust with regards to type 2 diabetes, because a lot of people don't know or are unaware that if you've got the diagnosis of type 2 diabetes, it can be you can ultimately put it into remission and get out of being type 2 diabetic by eating better and being physically active. And then through the pilot, we've funded a pre-rehabilitation program at James Cook University Hospital around trying to get people fitter before surgery, because evidence and research shows that if you're fitter before surgery and your body's in a better state, then your surgery will ultimately be more successful, and your recovery time will be quicker after that as well. So across those 4 themes, my areas of focus are the type 2 diabetes work and then the pre-rehabilitation. So, working with, health professionals within both fields, making sure that the funding that we have through Sport England is helping them to deliver what they wanted to deliver, but making sure that physical activity runs through the heart of both of those. So, when the type 2 diabetes pathway gets underway, they'll get specialist support around the diet, and they'll get support from dietetics and the professionals within that field, but they'll ultimately then be supported and promoted through physical activity opportunity, and again with the prehabilitation as well. Patients are listed for surgery, but then supported through physical activity classes and opportunity, so that when they get to surgery, they're in a better physical state. So like Lauren said, it's a very, very broad pilot, and there's lots of different elements to it, and they all work at very different paces. But yeah, those are the kind of the 4 areas that I'm kind of supporting and part of, really.
Lauren, what about yourself?
Yeah, so as kind of James did the overview, so my thematic areas are Slimming World, so working with Slimming World across the South Tees, and also working with health professionals, that's specifically GPs and also social prescribers, so GPs, nurses, that kind of the whole GP surgery environment, and social prescribers, obviously, who are a new addition to that kind of network. And then I also work within the Redcar and Cleveland wards, so Grangetown and South Bank, on our place-based approaches. Specifically, kind of one of the priorities that we're looking at is an insight-led approach. So quite a lot of what we're doing have been doing over the last kind of 2.5 years is capturing insight, both an insight we mean literally talking to people in their alleyway, on the doorstep, doing surveys, having focus groups. It's a real mixed method approach, so trying to get the voices that wouldn't normally be heard in both senses, so from both the professionals, because actually we've never really sat there and asked a GP what their barriers are to talking around physical activity. We normally actually just provide them with a poster and some referral forms and say, go on, get yourself into there, tell those people to get into that activity. But actually there's a whole breadth of barriers for them themselves, never mind the actual participants, that we need to kind of deal with first. And similarly with the focus wards, it's around, trying to capture insight from people who wouldn't turn up to the community centre, don't have the confidence to go out, and actually getting the real barriers to being active. It's not time, and it's not, I don't have enough money, and it's not because it's not the right location. What we've already found is it's around crime, fear of not feeling safe. It's around, not feeling confident or comfortable being active, or actually not knowing that activity is something that you're allowed to do if you've got like a long-term condition or a disability. So it's all of those things really, and that's where we have a focus.
It really does seem that the whole systems approach that you've got in terms of supporting those people in the South Tees, it's going to really do great things to change people's lives, and really encourage people that there are other things for them to do, that if they can't access one thing, there's other things for them to access, that there's free things. It's amazing just to hear how this whole systems approach is working so well for you guys. It's fantastic. It really is such a positive thing for people in the South Tees, isn't it?
Yeah, definitely. And I think the strength that we have is actually our exchange, which is our partnership, because we have such a breadth of organisations, from housing associations to the usual kind of sport and physical activity organisations, VCS, little community organisations in our wards, and everybody has a part to play. And one of the main things actually that was in the kind of bid for us is around actually just connecting people up to more of themselves. So the phrase we use is connecting the system up to more of itself, because if we can do that, we're not needed forever. It's a sustainable model. It's stuff around, it's not requiring us to deliver all the time. It's actually people who are already there, already working with those people and organisations, and just adding in physical activity where they'd maybe not thought it could be added in.
Yeah, no, it really is. It's amazing. As you said, it's that sustainability is something that it's a really big word around the sport and the leisure industry, isn't it? It's making these things that perhaps there's an initial outlay, but then by the end of the day it needs to wipe its own feet. It needs to be able to run without perhaps you guys there, and you guys that have helped get it set up. Then you can step back and just see the fruit of it all, really, and the fruit of the hard work actually, that it can still happen without you technically leading on it, and other people are there that you've equipped with the skills, with the capacity to be able to do it, and putting the right people in the right place is so important, isn't it? So this year, as everyone knows, has been a year like absolute nowhere. So how has COVID impacted you and your job in terms of how you've had to work, how your job might have changed? I don't know, James, do you want to go first and tell people how it's impacted you?
Yeah, I mean, I think like a lot of other people, when COVID hit and the world kind of just stopped still, it was kind of like, well, how the hell are we going to deliver a community-focused pilot with no community? And how are we supposed to support healthcare professionals and the medical side of things when their focus has completely shifted from just dealing with everyday life to supporting a global pandemic? So I think we panicked a little bit and then got our heads together and just kind of sat back and thought, well, where's the opportunity in all of this? You know, where can we try and support people virtually, digitally? Where can we support, if anything, and keep work ticking over and moving forward? You know, we've always tried to plug the message that this pilot isn't about sport and hockey and netball and basketball. It's around moving more and walking and cycling and going out in the garden. So I suppose for the first few months, it was kind of just getting our heads together and coming up with some ideas. I think Boris massively helped us in a way, because he shut the whole country down, but then told everybody that you still needed to go out and do your 30 minutes of physical activity, which was really interesting for us because, you know, people were on furlough. Unfortunately, people maybe had lost hours in their working week and couldn't go to work, and kids were off school and stuff. So you naturally saw more people going outside, and I think the weather helped as well because we had a hot summer that around May time, and April, May, June. So we saw a lot of people going out and getting their fresh air in their 30 minutes, and we were able to understand from communities, you know, how much people benefited from doing that small amount of physical activity, and actually seeing them realize how capable they were of doing that. You know, I think if you'd have asked somebody before, do you fancy going for a 30-minute walk around where you live? Oh no, I couldn't do that, I don't have time, and I couldn't walk for 30 minutes or something like that. So people actually went out and did it. So that was really interesting. We got a lot of insight from that around how people actually valued the fresh air and being outside, and how it helped their mental well-being, and how it kind of got them away from worrying about work or COVID or supporting families or whatever issues that they had. So I suppose that was something for us to grab onto. But I'll mention one thing that we did in collaboration with yourselves at Tees Valley Sport and, you know, the local authorities across the Tees Valley, was that we'd highlighted through insight and through learning from the organisations that we work with that there was going to be a lot of isolated young people that weren't being active and couldn't go anywhere to be active because everything was shut down. So we created activity packs that people could use at home or in their back gardens if they're lucky enough to have space behind the house or in a yard in front of their street or whatever. And we kind of co-designed those bags with young people through virtual means of Teams and Zoom and stuff. And we distributed hundreds and hundreds and hundreds of bags across the Tees Valley, which kept us busy because it was a much bigger job than what we thought it was going to be. Just distributing them around. And although it was a needed thing to do, it was a nice thing to do as well. You know, we've seen how communities are, or did, or still are probably, you know, pulling together and supporting each other. And we felt that although it wasn't going to be a piece of work that would benefit people for years to come, it helped them in that period of time. So yes, I mean, Lauren might want to touch on other things, but I suppose for us as a pilot, it was just about keeping going and keeping that energy going and trying to do what we can when people are distracted with other things, and, you know, quite rightly more important things than trying to make people physically active. But yeah, it did kind of put a big stopper on a lot of stuff, and we're still trying to kind of catch up and pick up from where we left, really, because we've ultimately lost probably nearly 18 months now of community delivery, community consultation, going out and trying to spread the message of the pilot. So yeah, I'll pass over to Lauren if she wants to add anything.
Yeah, anything you want to add, Lauren, to that?
Yeah, just kind of, we were at March of last year, we were at a really exciting point in the pilot. So we were actually just we'd just done all of our kind of original insight work. We had a focus on where we were going in the communities, and we were about to start co-designing, so working with different demographics of people within our focus wards through creative means. So it wasn't, 6 people in a room for 6 weeks, because you only get the normal six people in. But it was all very face to face. It had to have a level of, interaction. So that was kind of put on the brakes, and obviously Slimming World kind of shifted their way of delivery. So it was then virtual, which then challenged the way we were working. And also I was ready to launch stuff around the health professionals, around active practice, which also then was basically put on the brakes, because actually it was all around putting things within the physical environment that challenged patients' expectations around what they were, their GP might have a conversation with them around physical activity, so be prepared. But nobody was going into the physical environment of the GP surgery, so that was a bit of a problem for us. But I think one thing I probably want to add is actually, because of the nature of the pilot, of it being, we don't have an action plan, we don't have KPIs to meet. It's all a very flexible approach based on what the needs are, what's the insight telling us right now, that it allowed us to actually be flexible with the times. So we probably had less stress than other organisations that had targets to meet, because actually what we could do was shift basing on what is the need of our place right now. And we were able to see that through another member of our team, who's our insight officer, Jen, because we have something called Sentiment, which is a platform of like social listening. So you could actually see how people were talking in the South Tees on like Twitter and places like that. And also we have storytellers from Normal Wilburn Associates that were having Zoom calls with residents across the South Tees. So we could just really understand what was happening, what were people feeling like, where can we support them, which then actually allowed us to then still have the ethos in the programme that we were always wanting to do, making sure it was insight-led and co-created with those audiences, but actually not kind of put it on a back burner. We were still able to take over in a very purposeful way, utilising the same ethos we've always had.
I think the one thing for me that COVID's done is it's shown how innovative organisations can be, and how you've got to think outside the box, and how you've got to be flexible in your approach. As you said, Lauren, you have to adapt with things, and what you wanted to do in February 2020, in March 2020, you had to completely change, and all these plans that you had in place, you just had to almost flip them on your head completely. And it's been amazing to see how organisations have adapted and how they have managed to keep sustaining throughout the process. And interestingly, James, you mentioned activity packs. In one of the schools that I'm actually in at the minute, a couple of the kids have mentioned them. They saw Tees Valley Sport and the bags, and they remembered them from the lockdown period. So it's amazing that children who you're seeing in the schools now had access to those bags, or knew people that had access to those bags. And the impact that they may have had in someone's lockdown, we probably will never fully understand. Something so, well, I say simple, it wasn't simple together. An activity pack that kids get with, what was it, a skipping rope and the sketch set and things like that.
Basic stuff, yeah.
It was the basic stuff that, that impact, it'll never fully be understood, I don't think. And what impact that may have had, we'll never fully understand it. And it's amazing, as it wasn't simple put together. It could have been a lot easier if it hasn't been for lockdown. Trying to get that equipment was a nightmare, wasn't it? And meeting then the load in the sports hall that we had to work around. And if people fully knew the stresses that it caused, that it didn't matter. We just had to get it done, didn't we? And we had to adapt, and we had to move, and we had to just keep going with things that, you know, could have had and might have had huge impacts in children's lives.
Yeah, I mean, and I probably think if we didn't have a lockdown, we wouldn't have done anything like that. We wouldn't have done something so something so reactive, really.
Yeah.
We probably would have known that the people that were receiving those bags were still probably going to be inactive, and there'd still be a demographic that we'd need to target and work with, but we'd have had other issues to deal with or other areas of work to focus on, and they probably would have got lost. But yeah, like you said, just, you know, I don't think we'll ever really truly understand the massive impact that it might have had on some people, and those probably aren't physical activity related in the slightest. And I remember dropping some off with one lady who was going to distribute them out to hard to reach families, and she said that it'll just be nice for the kids to receive something as in a present, a gift.
Yeah.
You know, they haven't got much to look forward to. They haven't probably had much to look forward to before the pandemic, never mind during one. So just to receive something that they can call their own. So I suppose that kind of made up for the hours and hours of opening and closing boxes and getting wet for 2 days straight or whatever it was.
But do you know what the funny thing for me about that was, now looking back, that for me was the first time that I'd been out of the lockdown bubble, and it was, you know what, I remember the feelings I had about going to do it. It was quite nerve-wracking, you know. It was getting out and seeing people again, and it was the first time that I'd been working outside of the house for months, and it was, but again, just for the impact that I might have had in communities, it was so worthwhile. And it was great that we were able to work in that partnership and you know, work together with all the local authorities and just get something done so quickly. It was fantastic, wasn't it?
Yeah.
Yeah, and rallying the troops to actually pack them as well. You know, obviously we had some of the guys from MFC Foundation, and we also had people from public health and stuff coming, because we needed all hands on deck to pack those thousands of bags and skipping ropes in.
Definitely. So going back to, you've got this, what are the long-term aims and targets, if you've got this? I don't know who wants to take this one first, but what you know, have you got any longer-term visions, longer-term targets, goals?
I think, like Lauren pointed out, it's to do us out of a job ultimately, because like Lauren said, you know, the pilot isn't there to deliver stuff. It's around building the capacity within the South Tees to do it themselves, and for people to value physical activity and to take those small steps into becoming more active in their everyday lives, whether that's walking to the bus to then get on the bus to go to work, or spending Saturday afternoon to play outside with the grandkids in the park. It's, you know, it's creating that sustainability so that people can deliver and value physical activity, so that our funding isn't needed anymore. We've got until 2025 to do that, and although that sounds like a long time, it'll go within a flash, I'm sure. But yeah, I suppose our overall vision is just to build confidence within communities, and it's to make physical activity seem like a concept that is for everybody. And it doesn't need specialist equipment. It doesn't need a little bit of income to go and pay and do something. It's just something that everyone's got the capacity to do, hence the name of You've Got This. It's kind of, you know, it's there for everybody. It's just making people feel confident and comfortable to do what they can when they can, and for them to understand the overall benefits of physical activity. And we're probably more bothered about, you know, this tackling social isolation and tackling mental well-being, rather than encouraging people to gain a six-pack or to lose inches off their waistline. It's those social elements. And we kind of always say that the pilot probably started off as a sport and physical activity development piece of work, but the more that we dig into it, it's more of a community development piece of work. It's getting them to understand and value where they live and what's on their doorstep and stuff like that. So I suppose the goal for us, just to summarize and for me to stop waffling on, is it's almost like to raise awareness, I suppose. It's and just to get it on people's agendas. I suppose that's probably one of the main things, or to get people to realise that they're already doing stuff to promote physical and activity and well-being. You know, work with organisations to think about physical activity, make it something that they consider embedding into whatever work that they do with communities, and just having the confidence to think a little bit differently about how they support people who they work with, or and to be a bit more empathetic with people around understanding what people's actual barriers are. I know Lauren alluded to the fact that we always think that people aren't active because they can't get to somewhere or they can't afford it, but there's a whole lot of other issues that people are having to deal with, and those are things that get in the way. And people have the confidence and capacity in some cases to do it. There's just other stuff in the way, and I think we've learned very quickly that there's a lot of people that do value physical activity. And we assume that they don't, and that's probably where we kind of went wrong at the beginning. We kind of just assumed that people who are inactive don't really want to change, if that's the right word, but they definitely do. They've got other things going on.
Anything to add, Lauren, to that, or is James's waffling anything you want to add onto it?
I'm good at waffling.
I think just to kind of maybe bring like a whole system change kind of approach to life a little bit. So what it kind of means is, you know, it's when planners are designing new roads or new housing developments, that actually you make it easier to walk and cycle than you do to get in your car. You know, that's how you embed it into that physical environment. That's a policy, you know, saying actually every development that comes through has to have this in. That's great. And that could then change, you know, that changes communities, because actually the environment is actually encouraging them to be active. You know, it's easier to walk to school than it is to drive and drop the kids off, because actually we've got to go all the way over there rather than just cutting through. You know, it's around actually getting people to value and utilise open space and green spaces within the community. But that comes actually with a sense of, well, we need to make them safe. We need to tackle, like, you know, all of the barriers and issues that's there. So I think some of the things is actually just putting physical activity into every tiny little, you know, having a little question all the time. Could this have physical activity in? Could we be encouraging people to ride here? Could we actually get that? And if we can get more people from different organisations, from the community, actually asking that question of themselves, then we've done our job.
Perfect. James, I'm just going to touch on something you mentioned. You mentioned about mental health and mental well-being. Do you think that's something that you'll end up having a bit more of a focus on during the, like, after what's happened with the COVID? Because I know that I've had numerous discussions around my work, around my friendship groups, around my sports team, around mental health, and that mental health awareness and mental health well-being. Do you think that's something that you've got this may try and work a little bit around? Is that something you've always had a focus on? What's that been like for you guys?
I think it's probably always been one of the factors that we think supporting people being active will help, because obviously it is kind of obvious that, you know, activity can improve your mood and your mental state and stuff. But I think with the pandemic and everything that's going on, and the quite large focus around, you know, maybe males speaking out more about their mental health, I think that I don't think it will take us to kind of move that work forward. I think it will promote people to come to us and say, look, this is an issue for us. We want to kind of work with you on this. You know, we've got links with, you know, public health specialists within Public Health South Tees that have a focus on mental well-being, and they've been linked with the pilot ever since it started. So I suppose it's always been on our radar. We've just commissioned a small grants process called the Your Active Living Fund, that's funded a number of different projects across Middlesbrough and Redcar and Cleveland, and some of those have a mental wellbeing focus. So I suppose one job for us is to you know, we've understood that project's needed to support mental health, but it's a job for us to understand how those projects have gone and what the impact has had on people's mental well-being. So I suppose if you had to rank it in importance, it was always probably up there, but it's probably just jumped a few notches higher, because we kind of know that the more people are talking about it, the more it's becoming a thing on everyone's agenda, rather than just the physical activity sector, the health sector, that kind of thing. And I suppose people have missed out on a lot. You know, people have not been able to do what they normally want to do. If you are part of a sports club, you haven't been able to meet up with your teammates. You haven't been able to get back into some sort of routine where you're playing sport on a regular basis, or you're meeting up to meet friends to do your exercise class or whatever. So that's had a detrimental effect on people's well-being, and you've kind of not appreciated what you've lost until it's gone, and now it's coming back. And people will probably enjoy doing what they did before even more now, because they can see how much of a better impact it's had on their work-life balance, on their mental well-being, on their physical well-being. So can't really say specifically that, you know, it's going to be a massive focus for us going forward, because, you know, everything that we do is insight led, and if the insight takes us in a different direction, then we'll follow it. But I personally think it'd be great if we can always keep that on a priority list for ourselves.
Absolutely. Well, that's it from me. I just want to thank you both so much for giving time this morning to chat and to let people know a bit more about You've Got This and the local delivery pilot. It's been brilliant. But just before you both go, do you both, if people want to get in touch with you, how can they get in touch? What's the best way? Lauren?
Well, we've both obviously got email addresses, which we can share. It's literally just our full names with a dot in the middle, and then at you'vegotthis.org. But we've also got our website and our social media platforms. We're on Twitter, Facebook, Instagram, LinkedIn. We have a comms officer, Liv, who's really savvy with all of that, kind of leaves me and Lauren behind with regards to social media tech. But we realise that those are really important tools to have and to be on, because, you know, social media is massive and the community really take to those platforms and talk through those. But I suppose our website is you'vegotthis.org.uk. I'd say that's still a work in progress, because, you know, probably COVID's stopped that development a little bit, but we're busy trying to create new content for the website, and that has a lot of ways and avenues of getting involved and getting in touch with us. Lauren, do you want to add anything?
Yeah, on the website there's a contact form as well, so if you're from like a club or group or organisation that's in the South Tees and you want to kind of know a little bit more, or even if you just go, I don't really know if I can get involved, but can I? We're always here for that kind of query question, of because actually 90% of our work is, what's that? Can we do it? I don't know. So we're always willing to plod along and find it out with you as well. So that contact form is on our website, so you'vegotthis.org.uk, and you can just, it'll come straight through on an email to us and we'll get back in touch as soon as we can.
What I'll do is I'll put all that information in the show notes. So people do want to reach out to either you two, or go to your website or your Facebook, Instagram, anything, check it out. Then all of that will just be on the bottom of like the YouTube channel or wherever they're listening. If it's a podcast, listen to the podcast. It'll be dead easy to find. But yeah, just thank you both so much. It's been great catching up with you both.
Thank you.
Few more people will know a bit more. You've got this. Yeah,
and we could also meet face to face soon as well, because I'm getting sick of being stuck in the same room for 18 months. So
I know the feeling, mate.
If anybody's local to the South Tees and wants an actual meeting face to face, then I'm all over it. So yeah, happy to come and see anybody and everyone.
Contact James. That's the one that you want to meet face to face. Anywhere, anytime. James is the man.
Anywhere with a cup of tea, it'd be fine.
Brilliant. Well, as I say, thanks very much both, and enjoy the rest of your day.
Thank you. Cheers, Matt.
What a great episode that was. I think it was fantastic to hear a little bit more about You've Got This, about what James and Lauren both do and the work You've Got This do across the South Tees. I will be putting all of the links in the show notes. So that'll be for James and Lauren's emails. You've got this website, for the Facebook, for the Instagram, Twitter. I'll put everything on. I'll put everything on the show notes so people can get in contact with them. If you are in the South Tees and you are after some support, please do contact James and Lauren. They do provide support to so many different clubs, community groups, organisations. And even if you don't think you are perhaps the right person to get in contact with them for support, just try it. And if they can offer you support, they absolutely will. So thanks everyone for listening, and I hope you enjoyed the episode.